Hello, everyone, and welcome to week 4. I hope that everyone had a wonderful week 3. I did want to go back over a couple things in regards to week 3. This is always a very difficult week for everyone. Cardiovascular, pulmonary, and hematology can be difficult to grasp. I know there's a lot of material. Everybody done really good on your PowerPoint presentations and the other assignments as well. I'm very proud of everyone so far. What I did want to let everybody know as far as anemia goes. Anemia is something that you're going to encounter in clinical practice on a daily basis. And please know that anemia is never normal, okay? I tried to find a couple of YouTube videos to share with you guys about how to differentiate the different types of anemia. I'm still looking for those, so I'm going to try to post those in an announcement and maybe email them to you guys. But just know that anemia is never normal. Anemia can be grouped into microcytic or macrocytic anemia based on the indices on your CBC. And for the most part, the big worry, especially in someone that you identify that has iron deficiency anemia, if that person has iron deficiency anemia, you have to rule out colon cancer. It's colon cancer until proven otherwise, especially in the older population. So please don't take anemia lightly. Make sure that you do a thorough workup on anybody that you have with anemia. So I just wanted to point that out. Now, let's go to the syllabus. I wanted to go over a couple things in week 3. Hang on just a second. I'm sorry. Let's see here. Okay, week 3. So PowerPoint, anemia. We covered that already. This case study here, pretty much everybody got the first one right here, atherosclerosis. We had a couple who missed this one, the buildup of lactic acid. So if you did miss that, please go back and review. Now this question here, everybody done really good as far as the similarities and differences with emphysema and chronic bronchitis. And everybody did really good with the pulmonary embolism question. However, I did want to show you guys something that may help you in clinical practice one of these days. Probably can't find this in your book. If you ever have a patient who you suspect may have a pulmonary embolism and you have the capability to do an EKG in your office, tuck this away in your head. This is called the S1Q3T3 pattern. So please, this is not diagnostic of a PE. If you suspect PE, this is just something to help you make your case. If the patient has this, you can't diagnose PE. Of course, you have to get a VQ scan or a CTA of the chest, but this will help you make your case. If the patient doesn't have this, don't discount PE either. This is just another test that you can do in the office to kind of make your case. But you'll see S waves in lead 1. So you can see this negative deflection here on the S wave. You'll have a really deep S wave in lead 1. And then when you look at lead 3, you'll have a Q wave. So you'll see this, Q waves are, sometimes it's okay to have a small Q wave, but for the most part, Q waves are not normal. So you see the Q wave circled here, and then you'll also have inverted T waves in lead 3. So this is just a good little thing to kind of have in your back pocket if you're suspecting a PE in someone to try to make a case for a further workup. So I just kind of wanted to show you guys that. Other than that, everybody done really good with week 3. We're moving on to week 4. So we're going over neuro and musculoskeletal systems this week. So you'll read chapters 15, 16, 17, 18, 19, and then 44 and 45. I wanted to kind of go over this viral versus bacterial meningitis assignment. Seems like every semester I have a couple students who kind of do this in a way that is not the most desirable. We'll just put it that way. So the first of all, the assignment's worth 8 points. It's due Sunday by midnight. You are to develop a clinical correlation scenario for both viral and bacterial meningitis. What this means is you are to develop a scenario for a patient who has viral meningitis and one who has bacterial. So I want you to go, just like you're giving a report to someone, you've got a 19-year-old female that has symptoms A, B, and C, and so on. I don't want a table that says, this is what viral meningitis looks like, this is what bacterial meningitis looks like. I want this to be in paragraph form. I want it to be scholarly written. We're all grad students here, so we need to make sure that our writing skills are up to par. So please develop a scenario like you're working in an ER and you have this patient come in. So do that for each. Provide the complete blood count results. So that's the full CBC. So make sure you list the full CBC. And I don't want a range. I want you to pick a number. So let's say, for instance, in bacterial meningitis, your white blood cell count's high. Don't just say high, or don't just give a greater than 11,000. Pick a number. Pick 15,000. Pick, whatever you want to. Make this like a real case that you might come into contact with. You'll also want to list your white blood cell differential results, your gram stain results. This is what, just don't put positive or negative. Do a little bit of research and see maybe what the most common type of bacteria you find in meningitis maybe, and list that. You want to list your spinal fluid, protein, and glucose results. And like I said, pick a number. If it's supposed to be high or low, pick the number. Don't just put a range there. So you're going to create a scenario for 2 patients, one with viral meningitis, one with bacterial. Also, be sure to include signs and symptoms and how lab findings correlate with each patient. So no tables. We actually need to write out a scenario for each. We do have a discussion board this week. As always, it's worth 16 points. Initial post is due by Friday, and then 2 responses due by Sunday. So on this one, you're going to go to the National Institute on Mental Health. We're looking at depression here. And you're going to pretty much follow this. How might you use this website or the information here in your education practice setting, primary care setting, or management setting? Post your answer to the week 4 discussion board and respond to 2 other students. Then we also have a short answer question assignment, also due by Sunday, worth 16 points. So this is kind of self-explanatory what we've been doing in the previous weeks here. So you'll need to answer these questions, as always, APA style, reference page, running head, page numbers, scholarly writing, and that finishes out week 4. But I just wanted to praise everybody. Everybody is doing really good. I'm proud of you guys. I'm still going to try to dig up. If you guys are interested, if you're interested in me trying to find some videos for anemia, if anybody struggled with that, let me know, and I don't mind to maybe email some help out. I know we're kind of moving fast here and we're trying to focus on a different section now, but if that would be of help to anyone, just let me know. I'm always here for questions or for help. So you all have a strong week, and I'm here for any questions you may have. So I will talk to you guys in another week. Thank you all, and have a great, great week.